Thank you for this opportunity. I just wanted to say a few short words before the program began. So, as district attorney, I get notified of what's known as an unattended death. And that is someone basically who has passed away without any other witnesses around. In a typical scene, it might involve someone that perhaps had a heart attack at home and a loved one comes upon the person and sees that they have passed away. It also includes situations when someone may have overdosed in a particular location, but it also includes instances of suicide. Now, I took office in January of 2023. And throughout the entire calendar year for 2023, we had 32 suicides in my district. It's all of Cape Cod, which is 15 towns, Martha's Vineyard, which is 6 towns, and the island of Nantucket. The following year, in 2024, it rose to 37 suicides. Now, in the summer of 2024, one of my staff members applied for a grant. It's known as the Byrne Grant, B-Y-R-N-E. It's a federal grant. And it basically gave us an opportunity to try to secure funding that we could share with stakeholders in our local community that worked with groups and organizations to try to address issues involving mental health and suicide awareness. And I gold star to my staff member. She wound up securing in total $129,000. We were able to disperse it. I believe we gave approximately $50,000 to Sharing Kindness, approximately, and maybe around 60 in total for the various programs for Dr. Maura Weir, who I know is here tonight. So you've now heard the numbers for 23 and 24, and we dispersed those funds. It was a combination between the end of December 24 and January 25. Now I have the numbers for 2025. 22. Now, any suicide is obviously one too many. But it appears, I don't have any direct evidence of this, but it appears that the commitment that's being made by these organizations and others, and I know Sharing Kindness has launched the Hope Squad, which is incredible. I mean, how many schools are you up to now? 14 schools. And when I first met you, I think you were on 2 when I first met you. So we're making an impact. And I really wanted to say thank you certainly to Dr. Maura Weir and Sharing Kindness. Kim, it's amazing. But also to Ina, thank you for once again bringing the community together so they can share their stories, we can learn from these stories, and we can grow from the stories. So again, thank you very much. Have a good evening. Unfortunately, I have to get to another event, but thank you for giving me the opportunity to say a few words. Thank you. Thank you. Thank you. Thank you. I got to get you more money.
Thank you, Mr. Robert, for being here. So tonight is, as I mentioned, it's our 3rd annual mental health awareness event, and our topic is suicide prevention, changing the conversation. An evening focused on awareness, an evening focused on education and compassionate conversation around suicide prevention. Together, we will learn how to grow. Together, we will learn how to support those who are struggling, support one another. Together, we will build a community where people feel safe, asking for help. Again, thank you so much for being here tonight. And tonight, I would like to share a little bit about changing the world one heart at a time. This is our mission. And if you'd like, you can visit our website. Every week we have events. Every month we have community initiative and programs. You're welcome to follow us and join us for next events. But before we start, I would like to invite a couple girls here. They're the reason why we are here tonight. They inspired me to raise this topic. Chelsea and Mel, thank you so much for your support, and they're wonderful volunteers. They're girls with the big hearts and good, wonderful friends. They come to the coffee shop and they became more than a customer to me. And thank you, girls, for your hearts, for your compassion. And Thalis, thank you so much. And I would like you to share a couple words.
Thank you for being here tonight. If it wasn't for Ina, we all wouldn't be in this room. That's Ina's superhero power. She's just out there trying to change the world. One cup of coffee at the time, and let me tell you, she does it. I absolutely love her. So we found out tonight that we were all best friends with Janik, who took his life December 17th. And we've all been going through a pretty harsh grieving process. And but in a beautiful way, we've all gotten to lean on each other. And I wanted to share, before I pass the mic, the last thing that Janik sent me. And I think we can all take from it. It's a Bible verse, John 1:5. The light shines in the darkness, and the darkness can never extinguish it. So I think as long as we're together, we're going to get through it, because I'm assuming if you're in this room, you have been affected. So, okay, you take it. It's your turn. What a lead up. Make me cry before I take the mic. Hello, everyone. Thank you so much for being in this room and taking the time to come here and want to be part of the community. Last time I addressed the room, I was at my best friend's funeral saying goodbye. And so, but the amazing part about that funeral and this night is it was all about community. You looked around, everyone was connected with everyone. And as I go through this grieving process and I understand suicide and I'm trying to rebuild my life now, having that impact my life so deeply, I've learned that it is truly not an individual issue or crisis, but it is a community one. So the fact that you are taking the time out of your day to sit here in this room and to be part of a solution and to learn about it or to just heal from it is amazing. And I just want to say thank you from the bottom of my heart for being here and to showing up. Thank you to Yanel and Rosa, who are in the back, who are Janik's grandmother and mother. And yeah, and thank you. You want to say something?
I'm Janelle. My son passed away this December 17th, so I'm so happy. I be honest, I don't want to be here today. I just registered last Sunday after I saw Chelsea or Melanie. I don't know because they are similar. So one of them posts the last in Instagram, encourage the community to come here. Let me be honest. After see different bunch of photo and video, I say decide, let me do this in his honor because I try to find the purpose of his death or the suicide in my life because the purpose of his death maybe I will find later, but what the purpose of his death doing to me, this activity is part of the and my process. So saying that, I think activity like that is good not only for us or our age. For me, is to be good for youngest people, as the one of the speaker that her son passed away many years ago when he was 17. My son, he passed away 7 days after he turned 26. So that's mean that now we having issue with those ages because in our generation is in our age that in 45, 30, because we had issue financially, depression with maybe a couple, relationship, or whatever. But now with those ages and the youngest people, especially the high school or the transition, the high school to university, is because we having issue with their sexuality topic. So the life, because they don't have, and they still find their own path to their life. So, and they are not strong emotionally. So those topics made them to commit, and they are target to commit the suicide. I try to figure it out. It's not my case and my son, but I'm saying that to trying to find the answer because it's not because it was my son, but in my case and experience, and they are witness, and he also, the now we have to help people as my son. He never give hints that we can find. So right now, this point, March 13, he passed away in December. That he give us some hints, some depression, nothing. He was laughing. Also, he baptized him last summer. So since that moment, he always be beside to the Bible. Even when he was working with the Bible, also the Bible was one part of the belongings. So that means that how he commits suicide. This is my question every single day. So the why also. This question is part of my days and my meals. Why Jenny do this? I never answer God because you never can answer a question some why. If you wanna question God, is for what, no why. The why no, doesn't exist. So for me, it's been good that you exist and to be here and those activities, especially for help the youngest adult people. Especially if good if you think to help youngest people in, for example, in DY, my case, because my son was a student, if you can start it to help those youngest people to the transition to the youth to adult, because another thing, the people they are not strong mentally and emotionally very, ¿cómo se dice? Débil, weak. So can commit suicide because they try to figure it out and find and they are not strong. You see, so the youngest people for me is the good target to help with activity like that, plus beside their parents. This is my opinion. Thank you for assist and thank you for being here.
Thank you. Thank you for sharing. Thank you so much. Let's give a hand to our future generation. Thank you so much, Carlos. We will have very special speakers tonight, and we will start with our first speaker, Dr. Moravir. Thank you so much for being here. You were here last year, and your speech was fantastic. I still remember it. Thank you so much. Let's give a hand to Dr. Moravir.
Good evening, everyone. Hello. How are y'all doing tonight? Okay, I'm okay. That didn't sound like too good. Is everyone know what was the nicest thing that happened today to you?
My daughter had a great day dressing up as Harry Potter for school.
Oh, Harry Potter for school. I love it. So one of the things that I try to do when I'm talking is trying to keep it real. So I'll give you a few statistics and stuff, but I think the main conversation for tonight is that suicide prevention is everybody's business, and it takes a community to do it. And I did some schooling outside of the U.S., and one of the biggest difference for me is that instead of asking the question like, why did that person kill themselves? They ask, what's wrong with our community that they don't want to live here? And to me, that's a really big, important piece that, yes, there are mental health elements to suicide, but there's also kind of community societal issues for it as well. So I just want to keep that in mind when we're trying to change the conversation, that it's not what's wrong with you or them, it's what's wrong with the area in which they live and they don't want to participate. Did you want me to swap? Okay. So, hello. Okay. Oh, we need to record. Okay. So when we're talking about things about changing the conversation about suicide, how many people grew up in maybe a home that suicide wasn't talked about? Okay, are you Irish? No? I said, how many people grew up in a household where suicide wasn't talked about? Yep. All of it. Yep. I understand that word very much. I just said, were you all Irish? Because in our household, mental health, suicide, alcohol wasn't really ever discussed. I just remember my uncle and on Monday, I would say, "Is he okay?" And my mom would say, "Oh, he's a bit under the weather," but she would never say like he was hungover or anything, you know. And mental health stuff, we just didn't talk about it. We just pushed it under the rug and, you know, just moved on with our lives. And I also remember going up to the nuns in Catholic school and my father saying, "Don't you dare talk about what's going on in this house up there. There'll be big trouble if you do." And we couldn't really kind of have those type of conversations. So for me, is changing the conversation. Right now, I'm the chair of the Cape and Island Suicide Prevention Coalition, and we're a group of people that get together as a coalition, representing different organizations on the Cape and the islands. Kim is on the coalition with me, and we all have probably different reasons for being there. But we have organizations, and then we have individuals as well. And suicide is one of those things that you don't really get into unless you become part of the group. And this is one of the groups that most people don't want to belong to. But what you find is that there are other people who have experienced situations where they lose a loved one and they want maybe sometimes to do something about that with their community. So they reach out and they join organizations like ours. So I'll just tell you about the Cape and Islands Suicide Prevention Coalition has been in existence since 2008. And in the beginning, we had like different geographical regions that participated, but right now we have representatives from Martha's Vineyard, representatives from Nantucket, and then representatives from Barnstable County itself. Cape Cod Community College is part of it, and also the Department of Mental Health is part of it, and the Wampanoag Tribe is part of it. Sharing Kindness is part of it. We have all sorts of different organizations. Bay Cove has just joined us, which is the local crisis unit. So we're trying to get all the right people to the table, and we have conversations about how can we help Cape Cod and the islands understand suicide, do a little bit more awareness about what it means to have someone die by suicide, and then what do we do afterwards as a community. So I think those things are super important. So that's why we want to change the conversation. And I just have some notes that I have to read tonight. This is my second presentation today, so I don't want to confuse them. But I think changing the conversation helps reduce the stigma around suicide. And I feel really strongly that it also increases connection with people. And I would like to be connected with people. I'm not really good about being on an island by myself. You know, I don't think we were meant to be like that. And I think people like talking with each other and they like to support each other. It's whether or not people are really truthful about their conversations. And I always say, like, someone says to me, "Oh, how are you doing today?" And by the time I answer, they're already gone out the door. Like, they didn't actually wait for the answer. And I think that's part of living in the world that we live in, that we don't take enough time to talk with other people and kind of check in with them and make sure that they're actually doing okay. And I think that's important to make that connection. And then I think that prevention sometimes is possible and sometimes it's not. And I think we have to look at having the awareness of, is there something going on with our young people or with our elderly people or whichever generation we think that's having an issue. And it starts with awareness and action, and that's the coalition's theme line: education, awareness, and action. So we do put on trainings, and we are part of the DA grant that Rob was talking about. So I'll just explain a little bit what he said, but the Cape Cod Community College got some money to do trainings for the general public. So they're posted on the Cape Cod Community College website. It's called CCAPE. And then we also got some money to run a Cape and Islands Suicide Prevention Summit last year. And it was at the college. And we had, I think, like 130 people at it. And it was a great day with great speakers. There was excellent speakers at it. People who didn't even know how or what about suicide came out of it with at least a little bit of something. So that came from the DA grant as well. And then there's another group called Console that got some money to train police officers and first responders in how to reach out to someone who might be thinking about suicide when they go out in a call and things like that. So the money is being spread around to different places so we can get the maximum kind of bang for our buck, if that's the right way to do it. So Kim's doing a bit, the college is doing a bit, Console is doing a bit. There's another group that got it for the women's Moms Against Guns or something like that. They got some money as well. And so that's kind of all kind of reaching out to the area. I know that he mentioned the statistics, and I'm super happy to hear that it's gone down this year. And it's really exciting to hear that. But as a person who studies suicidology and like is a bit of a nerd about it, I'm really glad that it went down. But as I explained before, we do it in 5-year trends because sometimes you'll have a peak year and then sometimes you'll have a drop year. And so it's really hard to say what happened in this year that it went down or this year that it went up. And so because we're about 2 years behind in the data, we can only really talk about maybe up to 2023. But on average, if I say on average, in a 5-year span, there's about 30 to 32 suicides a year on the Cape. Now, this 22 will bring us down dramatically, which will be great, maybe by 2. So we might get under the 30. But as long as I've been studying suicide in this region, it's been around 30 per year, no matter which way we put it. So I think we're doing great work, but I also know there's more work that could be done. And I think the challenge is to get people interested in the topic that sometimes is really difficult to talk about. And I think people have a hard time talking about their mental health and how they're really feeling, and especially about thoughts about suicide. I mean, who wants to admit that? Like, who wants to tell someone, yeah, today I'm thinking about suicide? It's not really something that people want to shout out to the rooftops and say it. And sometimes people don't say anything. There are people that die by suicide that don't tell a living soul that they're thinking about suicide. But we do know some things like sometimes before the death, they talk about it or they write about it or they put it on Facebook or something like that. We also know that other times they don't. There's just nothing there to go on. And so it takes trying to understand the different themes and the different patterns that come out of it. But the International Association of Suicide Prevention is really good. And that's their theme, is changing the conversation. And it's called Creating Hope Through Action. So whenever I come out to one of these events, I want to be able to create hope in the community that we can make a difference and we can help decrease the number of suicides. I don't know that we'll ever stop them all, but we'll do our best to make sure that we reduce the suicides. If we can look out for like early intervention or maybe even post-vention help. Because sometimes I feel like after the death of the suicide, people don't know what to do and they don't know what to say to someone, so they don't say anything. They just ignore the problem, and that's not really helpful to the community. So I think if we look at different things like how can we help, I think small actions make a huge difference. I often say, like, I have a story about my Uncle Joe, but my Uncle Joe had MS, and for years we used to go to his house on a Saturday morning and help him. It wasn't a question. We just had to do it. Mom would throw us in the car, and we would go down to Uncle Joe's, and my brother would be doing the bushes, and my sister would be doing the bills, and I'd be doing the cleaning, and that was part of our Saturday routine. But we also have a cousin who lives in another part of Boston who has some mental health concerns. And I'm like, oh, maybe we should go see so-and-so. And Mom's like, why not? Why would we do that? She wouldn't even come out of her room. And I'm like, but Mom, she's got some mental health issues. And Mom's like, no. Uncle Joe is sick. She's not sick. It's in her own head. It's in her mind. We're not going to do this. And my mom is 85 years old. She's off the boat from Ireland. It was one of those places where they never really talked about it. So she doesn't understand that just because you can't see it doesn't mean it doesn't exist. And I think that's a mistake a lot of people make, that because people can't see depression all the time or anxiety or suicidal thoughts, they think that either they made it up in their head or it's not really happening. And so I think if we can keep the conversation going about this type of stigma, including my own mom, she does her best, but she's really old school, and I understand that, because she's still the one that says about the lady down the street, she has cancer. She still whispers it. So can you imagine her telling people what I do for a living? She tells them I'm a youth worker. Yeah, she can't handle that conversation. So small actions make a huge difference when we're talking about the community. Anyone can be a helper. You don't have to be a doctor or a nurse or anything like that. You can find a way to help. Sometimes just having conversations and checking in with someone could be the best thing that happened to them that day. Trying not to maybe isolate people that might be feeling like they're not really sure which way their life is going at the moment. And then we want to build hope. Like I always say, we should be merchants of hope. Like when you leave here tonight, I hope you hear something and you just go out and like give someone else hope that, somehow, some way we're going to be okay. And I think that's an important piece to send off to you tonight. And then I think communities change outcomes. It's like a grassroots initiative. If there's enough people that care about the subject, I think we can make waves, and then we can ask for more services or ask for more money or ask for more clinicians or ask for more whatever it is in the community. I mean, look they were going to close Pocasset, and a bunch of people said, absolutely not, we're not doing that. And then they gave us a bit of an extension because people spoke up. So that's also something that we can look at doing. And then I think about the training piece, like how many people here are trained in CPR? Okay. It's kind of, sort of, but not really. How many people have had to use it? Okay, that was like 3 out of maybe 25. And so it's the same thing with mental health. I always say that CPR is for the heart, right? And something like mental health first aid is the same thing, but it's for your brain. Like, if that makes sense. I know Laura's here. Laura's a trainer. She would have heard that or actually used that before. But if I'm trained in CPR and somebody falls out of their car and drops down to the ground and stops breathing, I'm not going to go out and do open heart surgery on the person. That's not my job. My job is to find out, are they breathing? Do they have a pulse? And someone call 911. And that's what suicide prevention is about. You don't have to be the clinician or the doctor or the therapist or a suicidologist or whatever we're calling ourselves. You can be their best friend and say, how you doing today? Or you could be someone that says, I really care about you. I would miss you if you're gone. And things like that. And I think it goes along a lot further when people know that you care. And there's a great story about Kevin Hines. He was one of the people that tried to die by suicide by jumping off the Golden Gate Bridge. And he tells a story about how he was on the bus and he was crying. He got to the bridge, he was still crying. He hopped over the fence, he was still crying. And then he said, I just, wish somebody cared. And then a woman stopped and asked him to take his picture. And he was like, nobody cares. And then he jumps. Right? And he survives. And now he's out there telling his story about this. And his biggest comment that stuck with me was, he didn't really want to die by suicide, but he did want to stop the pain. And sometimes maybe suicide happens when people's coping skills aren't where they need to be for whatever's going on at that time. And Kevin is really truthful. He's really honest. He's really helpful in that he's very blunt about what happened to him. And actually, I always think about the fact that he didn't die, because I don't know how many people 22 people have survived off that bridge. But I asked him, Kevin, what happened when you jumped? And he just said, and excuse my language, he went, oh, shit, right? Because he realized what he had just done. And he didn't want to do it anymore. And that sometimes happens. We hear a lot of people say when they made an attempt and they started the attempt, they wish they hadn't done that. And they end up in the hospital or throwing up or getting their stomach pumped or, calling a friend. Oftentimes females call friends right in the middle or when they're thinking about it. And somehow, a lot of them get prevented. So I always think about that. You jump and then you go, I don't want to die. And then somehow miraculously, Kevin turns himself around midair and lands in a position that he didn't die. And so I asked him, why did he change his position? And he said, because I looked up how not to die going off the Golden Gate Bridge too. And I thought, oh, that means he didn't really want to die because he looked for how not to die, but he also looked for how to die. So that's one of the things about people who die by suicide. All the research shows that they're ambivalent, they're uncertain about it, right up until the moment of their death. A lot of them are uncertain about whether or not they want to die. And I think that's important to keep in mind for awareness, because that means I have hope that even if someone's thinking about it, maybe I can help. And even if they're to the point where they're ready to act on it, maybe I can still intervene. And I think that's the important piece for me, is to understand that hope brings hope. And if we can leave one message for someone, it may be, can I help you with your pain instead of you wanting to die. And I think that's super important. So I think changing the conversation starts with us. And I think instead of saying, I think this is not from anywhere where I work or anything like that, but I think a person who cares about you could say something that will make all the difference to keep you around, stay one more day, stay another month, stay another year, whatever it is. I don't know that you're always going to get that from Dr. Mara Weir, you know what I mean? But you're going to get it from Mara from Dorchester. You know what I mean? So I think that's super important. And I just wanted to say that I think if we kind of start with changing that conversation, I think we can kind of build up a community that cares and that looks out for one another. And I think that's creating hope through action. And I know that our coalitions are all over the state. So even if you're not from Barnstable County, there's another one in Plymouth, and they're all over the state. And the state has committed to funding. And actually, Massachusetts has the most amount of money of all the 50 states for suicide prevention. We also happen to have one of the lowest suicide rates in the country. So not that what Rob said is true or false, but think about that. We get the most amount of money for prevention work, and we have almost the least amount of suicides. It's great. So that's a good push to ask for more money. I think it was 630 suicides in 2023 in the state, and I think we're tied at number 48 with somebody else, and then there's only 49 and 50. So we're actually doing quite well as a state. The issue here is that Cape Cod has a higher than average rate of suicide compared to the rest of the counties in the state. And that's my worry. And I wonder what happens on Cape Cod that would raise the suicide rate higher than the rest of the counties in the state. And I guess that's what I'm committed to finding out. People could say it's region, it's stressors, financial stressors. It could be, you're working 4 jobs in the summer, you're working no jobs in the winter. Yeah? Yeah, sure. Yeah. It's far. We don't have a, yeah.
How you can make conversation, for example, like this, with the older people that we have here in the Cape, with the younger, a lot that we have right now. Because if you compare the Cape now as the Cape that when I came here from Florida in 2009, is totally different.
Different.
Now we have youngest, but this place is for retirement people. We have a lot of old people.
And that's what we hear often, right? That the geographics matter. I think geographically does matter in some cases. And I think we do have a higher elder population than a younger population. And I think sometimes there's not a lot of activity for younger people here on the Cape, which may or may not influence. We also have a higher financial stressors here, higher housing, higher food costs, things go up in the summer, traffic.
And unfortunately, country like this, I don't want to judge, I don't want to discriminate, but this country, and especially here, so how a young people or young person can make conversation with the older.
I know.
So, because first of all, the older gonna be, it's not my business.
Yeah.
And unfortunately, they the response.
Yeah. Intergenerational is a big thing on the Cape. It would be nice to do some intergenerational activities. I remember we used to do them out in Harwich, and the younger people went to meet the CAOs, Council on Aging, and they did things together for the day, and it was so fun. It was so much fun. This, oh, I love it. So I'll just say, because I don't want to take up all the time, is so the 5-year trend might go down now at these new numbers, but Barnstable County, Dukes, and Nantucket usually higher rates than the rest of the state. There is some screening going on, which is fantastic, but I think there is some elevated mental health needs or not enough clinicians to help with that, one or the other. And I think there's things like isolation, like a lot of people I talk to haven't even gone over the bridge, or like they think Cape Cod or Boston is really far away. And I think that has a lot to do with it. And there's transportation barriers too. Getting around the Cape is not so easy to get to appointments and stuff. But what the changing the conversation means is like we got to move from silence to like connections. We got to start making connections with people. It's going from stigma to support. How can I support you? Not, oh my God, you're thinking about suicide. I don't even want to talk to you, right? We got to do that. Hope is built through connections. I really find that helpful to me. And also that if we can train enough people, maybe we'll be able to help see some of the warning signs, the risk signs. So, like I said, Rob, the DA, gave people grants, but we do have the coalition and other people offering the trainings. But we have, it starts from QPR, which is like a 1 hour, I call it down and dirty training, get in and get out. Then we move up to like a safe talk, which is like a 4-hour training. Then we have 8-hour trainings for mental health first aid that other people can take that might be supporting somebody else. And then it goes right up to a 2-day, what we call assist training, where we train people to have that conversation with someone who's already announced that maybe they're thinking about suicide. And that's a scary topic for people. People don't want someone to say yes to that answer. So sometimes they just don't ask. And then we also have things like trauma-informed care, de-escalation. We have crisis intervention trainings. We have all sorts of stuff going on here on the Cape. We just need to get more people trained. And that's kind of one of the goals of the Cape and Island Suicide Prevention Coalition. The other piece, I think, would be taking care of yourself. Stress or burnout, isolation, like they're really common. And I think people try to handle things on their own. It's like you're weak if you ask for help. And I think self-care is actually a strength. And I think telling people that you need help is not a bad thing. I think surround yourself with good people and then kind of practice this, self-compassion bit. Try not to be so hard on yourself. So I think if we look at protective factors, if you kind of learn how to do your coping skills or resiliency skills, maybe try to find where your support is, take time out. A lot of people take walks on the beach, take up nature, read a book, like things like that, just to take a little time to yourself. And I think also when we're supporting each other, notice the changes in people. Notice what's going on with them. Say, hey, I noticed that you don't join us for coffee anymore. Is everything okay? Or I've noticed I haven't seen you at the meetings lately. Is everything all right? And kind of have those conversations with people saying, I noticed that, this, that, or the other thing. How are you really doing? That's what I want to ask. How are you really doing? And see how many people answer you truthfully. You don't need to get the whole thing, but you need to get that they're not doing okay and see if you can help them. I also think that if we can kind of nourish that with people, then they'll change their habits to, I think I should be doing something worthwhile every day to it's okay to have a bad day and hang around in your pajamas all day if you're just not up to it. Like sometimes just getting up and getting somewhere is enough, right? We don't know how people are feeling. So I think the conversation changes with us and starts with us. And I think if we look at things like the Cape and Island Suicide Prevention Coalition, they're really trying to get the word out there. And then with organizations like Kim's and other organizations like the Samaritans, they're also with us. They're engaging with the community and the people who have to experience this type of stuff. So I would say if you're looking for a training, come on up and let us know. But I think that for me, like changing the conversation kind of creates hope, and it will save lives. I hope it will save lives. And I think my goal is probably to create a suicide safer community on Cape Cod and the islands, and get people like more connected to be able to say, hey, you know what? It's not really a great day today, but thanks for asking, you know? And so I think what I would want to do before I close, just for a second, if it's okay, is I would actually like you to turn to the person that's closest to you and ask them how they're doing today. And really do it. Really do it. Really do it. It's tough, right? He's like, yeah, I'm not asking her. How you doing today? Really, really? Okay, good. That's good. I'm glad to hear that. All right. You ready? Yeah. Okay. Yeah. So how hard was that? How hard was that? To the guy that's sitting at the back like this? How hard was that? That was awkward, right? It was really hard to go, hey, how you really doing? Right? And I think that's what some people get worried about is you either don't want to say it or you don't want to hear it. Like, what if the person beside you said their day was awful and then they started getting into it and you were like, I didn't really need to know that, right? So we just got to look out for each other, take care of each other and stuff like that. I think we're going to do a little something to calm people down.
She read my mind because I wanted to do connections that we will turn to each other, look at it. Thank you so much. By the way, we have clinicians. Yes, let's give a hand. Dr. Mora, thank you so much for all your work. What you do, it matters. It matters. We have clinician present. Clinician, please raise your hand. If you need to talk to someone professional, clinician is here. And while Miss Kim, Dr. Kim, let's welcome Dr. Kim setting up. And my husband, thank you so much, Andrew Taylor, for technology and for recording us. And while Mrs. Kim setting up, let's take a deep breath together. Let's just close your eyes or open your eyes, whatever is comfortable. Take a deep breath. And say, I am loved. I am seen. God loves me. Thank you so much for being here. Each of you, it means the world. And let's, again, give a hand to Miss Kim. She has such a biography. She's a hero to me. She does tremendous work. And the army of people that you raised up and young people that you raised up, and you live by example. And we are so honored to have you here. Thank you so much.
Thank you. Thank you, Ina. So good evening, and thank you. Good evening. I'm going to echo a lot of what Dr. Weir said, but I also am excited because I think I will get to instill hope about some of the services that we are offering here on the Cape. So, and thank you. I have in my notes that talking about suicide can be triggering. I'm very grateful that Kim Kelly, who's there in the back, one of our clinicians, actually our program director at Sharing Kindness, is here. If anybody needs support, self-care, there's nothing that has a higher priority. So please let us know if we can support you this evening. I want to spend a moment or two sharing my story with you because I think my experience reflects the changing conversation around suicide prevention. I grew up here on the Cape, and I went to Nauset High School. I came back as a family physician, and I thought I would spend my entire professional career as a doc. And then life happened differently than I had planned. The first photo, the handsome young man on your left, is Jeremy, or Jez, the youngest of our 4 children. And the second photo, his favorite place, the woods. The photo with the big smile was taken in the summer of 2016 after 15 days in the woods with Outward Bound. He was so proud of himself, a 24-hour solo. What you cannot see is that from a very young age, he struggled with anxiety and depression. And in the fall of 2016, 2 months after this photo was taken, Jez died from suicide. And what I experienced, what my family experienced, were gaps in service. No trauma-informed grief support. And although suicide is the second leading cause of death, there was no peer-to-peer suicide, evidence-based suicide prevention. And as a physician, I knew these services existed. They just didn't exist here. And so now Sharing Kindness exists to build a grief-sensitive, suicide-aware Cape and Islands. So how are we doing this? We provide clinician-led, licensed clinicians lead our peer grief groups. We have groups that are specific for suicide loss survivors on Nantucket, on Martha's Vineyard, that just started this past fall, and here on Cape. We have some online groups now because we're trying to improve access. And we, this year, will have groups at 20 different school-based groups to meet children, bereaved children where they are. We raise suicide awareness via Hope Squad, which you're going to hear about in a moment, and the annual Suicide Awareness Walk. And we offer community outreach and education and presentations. One of the presentations that I encourage everyone to go to is called Grief 101, to address what Dr. Weir said, which is, okay, somebody in this community has had a significant loss. What do I say to them? Too often people don't know what to say, or they don't want to say the wrong thing, so they turn away. And that isolation, that compounds how that grieving person is feeling. So we're hoping to become a more grief-literate community too. I am pleased, again, to echo Dr. Weir, we're changing the narrative around suicide. Until recently, in this country, the narrative focused on what was wrong with the individual, and what was wrong with them was why they died by suicide. Systems-level thinking moves beyond focusing on the individual and allows us to look at these broader structural, cultural, and environmental factors. Because suicide is complex. It's a complex public health problem with multiple causes. And we also see health disparities. These are groups that have an excess burden of suicide. And that veterans, those that live in rural areas, well, guess what? That's us. 7 out of 15 towns in both islands qualify as rural. Sexual and gender minorities and people of color and tribal populations all experience health disparities. And this change in narrative on suicide, the systems approach, this provides us with an increased opportunity to decrease risk by addressing, impacting those broader factors. Something to know, a condition in our shared community here that increases suicide risk in Barnstable County, childhood bereavement. We have significant rates of childhood bereavement. Children who have experienced the death of a parent or sibling by the age of 18. When we look at the state of Massachusetts, it's 1 in 13. 1 in 13 children will experience the death of a parent or sibling, generally parent, by the age of 18. The states here in darkest green, those are the worst rates in the country, 1 in 8. In the fall of 2023, Sharing Kindness contracted with CBEM to do a deep dive on childhood bereavement because we suspected we had some pretty significant numbers here. And what did we find? If 1 in 8 is the worst in the country, 1 in 9. In Barnstable County, 1 in 9 children will be bereaved, primarily by the death of a parent by the age of 18. The CDC uses a really narrow definition of parent, biological or adopted. So this doesn't take into account the deaths of caregivers who don't fit that CDC definition. How many of us know grandparents here who are raising grandchildren or other kinship care? So the true bereavement number here is going to be even more significant than that 1 in 9. Somebody's always going to ask why, so I'm going to tell you the CBEM data showed that our children are primarily bereaved by parental death. The leading cause of death in these parents is accidental death, and accidental deaths account for 65 to 75% in the 4 years we looked at. And that's more than twice the national average. And within those accidental deaths, 77 to 93%, again, depending on the year, but an average in the 80s, were overdose deaths here in Barnstable County. Why is that significant? Children with unaddressed grief are at risk because of what has happened to them. They are at increased risk for early mortality, including 2.5 times increased risk of suicide. And looking at that in another lens, down there in the orange, 1 in 4 youth who die by suicide were bereaved. There are lots of other risk factors here associated with childhood bereavement. The one in blue, bereaved youth are 175% more likely to develop a substance use disorder in adulthood. So significant risks, including suicide, because of childhood bereavement here. One of those broader factors that we are hoping to impact. And we are also treating the adults who've experienced these losses. When Jez died, I did find a support group. It was led by a volunteer. The group disappeared within 6 months. The language wasn't always safe, and the psychoeducation wasn't trauma-informed. I know that leader's heart was in the right place, but I also knew that my family deserved better. Everybody's family deserved better. So this year at Sharing Kindness, we have 25 ongoing community groups, 20 different school groups, and 5 at the moment virtuals. Yes, it's exciting. It's exciting. A little bit more about suicide from the CDC Youth Risk Behavior Survey. There is a strong correlation between students who feel more connected in school environments and their mental health. And from published studies, the benefits of school connectedness are strong. When young people feel connected at school, that feeling of belonging protects them from poor mental health, from suicidal thoughts and behaviors, from substance use, from violence and sexual risk behaviors. So at Sharing Kindness, we support Hope Squad. Hope Squad is evidence-based programming. It's recognized by SPRC, that's the nation's Suicide Prevention Resource Center, as a best practice program. In the fall of 2022, so not even 4 years ago, we launched the first Hope Squad in Massachusetts at Falmouth High School. At that point, Hope Squad was already in 41 states and more than 1,600 schools. And we had shared with Falmouth High School administration, 95% of students in a Hope Squad school report knowing how and where to get help from their peers. Why is this important? Because AFSP, the American Foundation for Suicide Prevention, tells us, and Dr. Weir mentioned this earlier, about half the time our young people with suicidal ideation, they don't disclose. The other 50%, they do disclose, but 7 times out of 10, they disclose to a peer. So having a peer-to-peer program, it makes the most sense. So Hope Squad reduces youth suicide through education, through training, and peer intervention while fostering connectedness. So we begin with approval by administration. We bring in a master trainer to train a group of advisors. The Hope Squad members are nominated by their peers. They're nominated as being trustworthy, as being good listeners, as demonstrating empathy. all the attributes any of us would want in a friend. And the squad members meet regularly with their trained advisors to talk and to learn about mental health. They are trained to note signs of distress and to reach out, connecting peers to help. And they teach and connect with the entire student body to reduce stigma, to change the school and the community culture. And they are changing the conversation around suicide awareness. I don't want you to hear that just from me. I want you to hear it from them. Let me see. Oh, I hope this works.
We first got involved in Hope Squad. I saw Kim speaking at the one of the suicide awareness conferences at Four Seas. It's our first year getting it going, but we have a really great group of motivated students who really want to promote positive mental health in the school and create more of a sense of community so that everyone feels involved.
We'll have kind of like a kindness activity. We set up a little stand with Hope Squad signs, and we have bracelets. And we did this one time where we had people write a positive message on a paper link and connect it to a chain, and we had this really big chain going of positive messages, and people got a little silicone bracelet that said Hope Squad, which kind of helps spread the word of Hope Squad too.
This is a group that's really looking to spread positivity, and everybody has either been in a position where it was difficult and you had thoughts that weren't like so positive, or you've been there for other people. You've had to see people go through difficult moments, and just being there and knowing that you can do something for them, knowing that you can help them in some way, that's just always going to be something that can like strive you to just seek for that and just be part of it or support in any way that's possible.
I'm really proud to be a member of Hope Squad. Even though I personally might not be able to save someone's life, just being a part of the group that does save people's lives is just a really nice thing to be a part of. And I'm just really glad I have the opportunity to do it.
I did it. I'm not IT literate, so we ended up in the right place. Yay. So currently, Sharing Kindness supports Hope Squad in 14 Cape and Island schools. And that means we have more than 70 trained Hope Squad advisors, more than 450 Hope Squad student members. And each one of them is QPR trained, right, that Dr. Weir talked about. And those 450 squad members engage 8,795 peers in suicide prevention activities. Thank you. So changing the conversation around suicide awareness and prevention to build a healthier, more resilient, shared community. We are providing evidence-based grief support to bereaved community members, including at-risk children and survivors of suicide loss. We're hosting the Suicide Awareness Walk. Please come join us in May. We're providing Hope Squad, this evidence-based peer-to-peer suicide prevention, and participating in community conversations like this one. I want to end just this week, Wednesday and Thursday, yesterday and the day before, we had a nationally recognized speaker, Emma Benoit, come to the Cape, and we were able to do that with the funding from the DA Galaboy. And I'd like to close with Emma's words. Silence will never keep you safe. So let's keep having these conversations. Let's keep connecting and building community. Thank you.
Thank you so much, Dr. Kim. I have my friend Amanda Braga-Tipton, who is here. And Amanda, can we welcome Amanda? She's a wonderful former chaplain, right? Did I say it right? and she has an incredible Joshua Boots Foundation, and she will share a little bit about this foundation, about her.
Thanks, Ina. Thanks again, Ina, for the invite. I was here about a year ago, and were you here too? So, okay, but I definitely remember you, and I think you remember you from my day job in legislation. We were at Four Cs. Good to see you again, and thank you for continuing to do what you do. As Ina shared, my name rolls off your tongue like Smith, Amanda Braga Tipton. I'm actually from Cape Cod, grew up in 02536, better known as East Falmouth. And I served in the United States Army Reserve as a chaplain. I went down that path because I, at the time, was hearing a number that really, also, we're all adults here, right? So if something slips out of my mouth that is an adult verbiage, we're good with it. There was a number at the time that I was hearing that really pissed me off, and the number was 22. 22 veterans a day at the time were dying by suicide, and I thought, that is not cool. And I had this idea that if I joined, potentially I could impact one soldier, and that one soldier could impact their family, and then that family could impact a community, and the community could then impact a district or a state, or and then the nation. You know, there's a ripple effect, and that's true in our lives. There's a ripple effect with every single person that we come in contact with. We just don't necessarily see it, or often don't see it, at least this side of eternity. And so went ahead and did that. Had the privilege of serving in uniform for 5 years, but I was a reserve component. So my other job at one point was a hospice chaplain. And let's see, I have a brother named Joshua. And I typically don't get through this ever without crying. So thanks for the grace. Josh, my little brother, whose footsteps I followed in because he was in active duty. He served as a tanker in the United States Army, which means he made things go boom, boom. He got out of the Army, the active duty component in 2016, joined the reserve component immediately afterwards. And so his unit was out of Rhode Island, and Joshua was my best friend. We were 10 years, 10 months apart. And so I definitely had a maternal connection with him because for the moment he came out, I walked into the room when my mother gave birth, and I was like, oh my God, there he was, purple, because she pushed twice. He came flying out. The room smelled. There was fluids. I was like, what happened? And I passed out. And so my mom went, oh, my baby. And so the nurses ran to him or to me and to him. And I passed out twice. And then my dad was like, we're probably going to take her home now. So that was my first meeting of Joshua, who I named, by the way. And we were just besties. Actually, some of his battle buddies. Battle buddy is a term for a close friend in the military, or actually someone who's assigned to you to be your battle buddy, to watch out for you. They have your six. They have your back, right, all the time. And I just blanked out. And so Josh and I were like battle buddies, and his battle buddies and friends would always be like, you got a little bit of a weird relationship with your sister there. He's like, nah, man, she's just my best friend. So that outside of my relationship with Jesus Christ is the best gift that I was given on this earth. So Josh and I had a promise to each other that if we ever got in a space where we felt like we wanted to end it, that we would share it with each other, because we shared everything else. So to my surprise, on July 5th, 2023, just before 8 p.m., my phone rang, and it was my father. And on the other end, he couldn't speak. And so I knew that was not good. And my dad also served in the Army. And so very, men don't cry. And he was crying. And then all he got out was, it's Josh. It's not good. I'm like, what do you mean? And then he just said he's gone. I'm sorry, what? I don't know if this is what you went through, but at that particular moment, it felt like time itself stopped. It felt like I couldn't breathe. It felt like everything was spinning kind of simultaneously. I'm quite sure I was disassociating. And it just didn't make sense. To this day, it doesn't make sense. And with suicide, we often try to make sense of it, right? And we look at things, we analyze things, we get data, we get stats, we learn all the science behind it, the neural pathways, all the things, and they're all there. And even at the end of the day, if you're a survivor, it still doesn't make sense. So the next day, I understand that this can be very triggering, okay? Especialmente para ti. Mis sentimientos. The next day, we were released to go into my brother's home, and I'll leave out a lot of details, but I will say this because it's what at that moment was conceived in me. As I stood in my brother's room, I picked up his tanker boots. And so tanker boots look a little different than combat boots because tankers are getting in and out of the tank, right? And so there would be more potential for the laces on the boots to get caught on something. So tanker boots have just straps. And so my brother, before he passed away, took his tanker boots and placed them on his bureau. And then the battalion that he was a part of is called 1st Cavalry. Cavalry, send in the cavalry. Have you ever heard that? So they were one of the first battalions in the actual U.S. Army. And so in their dress uniforms, they wear a Stetson, like a cowboy would, right? Except theirs is a little bit more chic. And so he had taken that and he had put it on top of his tanker boots. And that's very common with veteran suicide and first responder suicide. There's often a ceremonial component where they do something that they're remembering their time attached to something that they felt purpose or pride. And so I picked them up and I was like squeezing them. Somehow in that moment, I remember thinking like if I squeezed them, if I hugged them tight enough, it would be like reaching Josh. And so as I looked down at them with tears down my face, I saw that they had scratches on them, that they had stains on them from the oil from the tanks, that they had like marks and mucked up and scuffed up because there were boots, right? And then I flipped them over and I realized that the soles of them were worn down because of his instep, and all of us have an instep. And so this thought came to me, if there's anything that comes from this, it's going to be called Josh's boots. And it's going to be called Josh's boots because every single human, independent of where you hail from, what nation you hail from, what your political belief is, what your job is, every single person can identify walking through seasons of life where you get mucked up, you get stained up, you get scratched, and your SOULS's get worn down. And so, last May, Josh's Boots became officially recognized by the federal government as a nonprofit. And our purpose is to honor the fallen always. And for me, that means not just those who are killed in action, not just those military or first responders who die by suicide, but who die in any realm. We want to make sure that we continue to honor those who have raised their right hand to protect and defend no matter what the cost. We nurture huge piece of my heart is for the survivors, obviously because I am one, and I know the pain and the brokenness, the guilt that can come, the questions that can come. the anger that can come, the resentment that can come, the betrayal, the feelings, all of it. And I know that suicide grief is incredibly complicated. And the third component is empowering communities with awareness, but then also providing tools for us to all go out and to do whatever we can first to help ourselves. And then second, our neighbor, right? And so that's part of who I am, part of what I'm currently doing. And we do have actually a little plug. We have our first official fundraiser, which is March 28th. It's called a Ruck and Roll. So what is a ruck? Thanks for asking. So if you've ever seen the really big backpacks that military personnel use, that's called their ruck, okay? And that's basically what it is. It's just a backpack with all of their belongings in it. And they can range anywhere from 60 to like 120 pounds, especially if they're going downrange, getting deployed. So that's what the term ruck comes from. In recent years, it has become popular for people to run, to work out in any capacity, adding weight or a backpack with a slight weight. It could be 2 pounds, 5 pounds, whatever. And sometimes they do it to mimic what a military personnel could be feeling, like the weight that they carry. In my particular ruck, I just have this opinion that every single person currently is carrying some sort of weight, so we don't need to add any freaking weight, okay? So basically, the Ruck and Roll is a walk or a run, starting in North Falmouth and the Shining Sea bike path down to Falmouth Hospital. Why Falmouth Hospital? Because if we did the whole thing, it's like 20 miles. And I was like, I don't have time for that. However, Falmouth Hospital is where my brother worked as a security officer as well. So there's some dual purpose there and meaning that's behind it. And so feel free to go to the Josh's Boots Inc. Facebook page and check that out. We're excited for that to be able to then take the monies that we receive. And I mean, the fun thing about having a nonprofit is you get to give everything away. It's like Christmas every day, Hanukkah every day, right? Kwanzaa every day. It's great. So that's, I know I'm reaching my time here. So that's what's happening right now. And I do want to close with this. After I got the call from my dad, he said, I'm on my way over and we need to go see your mom. Our parents were divorced. And so I think my dad ended just meeting me there. Drove over and saw my mom outside. And she saw the car, she saw me. And I remember she was smiling. She had no idea. And then she saw my dad's truck and she kind of looked like, what's going on? And I remember seeing her smile and I remember thinking, I have to focus on this moment and I have to remember this because everything, the trajectory of her whole life is going to change. So I was walking up the pathway, because in the military, they teach you always take the pathway. And then there was my dad who walked across the lawn. So he got to her first and he shared the news and my mother just fell forward on the concrete. And it was just my brother and I, by the way. And so I'm standing there watching this, helpless. And I think, I'm going to just go to the medical examiner's office and I'm going to pray for my brother to resurrect from the dead. That's what I'm going to do. And I said, God, can I go to the ME's office and pray for his resurrection? And I felt like in my faith background, I believe that the Lord speaks, my God, Jesus, still speaks to his children. And so I felt like he said, no, not this time. And I remember standing there and I said, okay, God, then I have got to see redemption from this. I have to, because right now, this feels like such an injustice. And this feels like the enemy won. So, I've had many people message me. I've had people show up at my door and say, Amanda, I heard about Josh's story. I heard Josh, or I knew you. I've had veterans pull me aside and say, I just want you to know that I was about to pull a trigger. And I remembered your mom, or I remembered you, and I put the gun down and I decided to get help. Last Friday, I showed up at a woman's house. She was celebrating her daughter's 16th birthday, and she had ordered hoodies. We have merchandise, and the front of it has our logo, and the back of it says, I hope you win the war you tell no one about. And so I delivered them, and then I just looked at the mom and I said, could I share with these girls about what this all means? And she said, absolutely. And so 3 or 4 minutes, I just shared with these teenagers about my brother, about the significance of what they were wearing. So in case somebody else asked them, hey, what does that mean? They would be able to share. And last night, the mother messaged me and she said, I just want you to know that this week alone, my daughter and friends have had 3 friends that were depressed or scared with anxiety. And my daughter asked me if we could make these girls baskets and bring them to them so they knew they weren't alone. I believe that last Friday, they were inspired by what they heard. When I get these messages, when I get the phone calls, I think, wow, Josh's boots, they're still marching. The survivors of suicide are 22% more likely to die by suicide. So, with whatever time I have remaining on this earth, it's one of my ambitions that that number would be near eradicated. And I understand the pain. I understand what it is to lie in bed at night and to actually pray that I wouldn't wake up because the pain was so consuming. And then I now understand what it is to start to see a little bit of beauty from ashes come forth. And that I get to be here right now, and I get to still have breath in my lungs. And because I have that incredible gift and privilege, and maybe I'll blame it on Josh, but he would want me to do that. He would want me to go into the trenches and to extend a hand to someone who feels like they're in complete darkness. He would want that. So, Ina actually asked if I would pray, correct? Okay. Grandma says, oh yeah. Abuela says, oh yes. Okay. I understand that there are people here that may not believe in God at all. That's totally okay. You do not have to participate in this, okay? Oh yeah. Mm-hmm. Yes.
came that day. So my first thought after the funeral is at what time he came to get home. At which time of the 24 hours of the day he can meet the bunch of people that were there at the funeral. So he was like that. So how you can be to see him is dead in this activity like that. Can you answer me that question? No.
I'm not sure I understand the question.
So that he was very happy. He was like a Robbie Williams, or maybe as your brother. So what's the first thought comes to you when they say suicide? For a person, depression. So for me, I try to say that maybe my son was fighting some, excuse me, let me talk. Maybe my son was fighting some battle inside they never show to anybody, even me or his friends in the back. Do you understand? So for us, it's very hard, very painful for death like that, for a person like my son, and for me, feel my grieving, or maybe I can feel how they are, because how was my son? So can you imagine if I feel like that? Can you imagine my mother, his grandma that he brought and raised until, and he's living the 2 last year until he's dead? Okay. Yeah, I can understand. So sorry, I don't wanna be like a sorry that I don't wanna bother you or the activity. But if you can feel my feelings, so sorry about that, okay? For the interruption.
No, that's okay. And really, basically, what I'm just going to say.
So use the microphone.
Basically, what I'm going to say right now is this is my prayer that the spirit of life would encompass every individual that's here and all of Cape Cod. That the spirit of life would go forward continually. Like we're able to look at the beautiful oceans and the waves, that the spirit of life would go forth like that over this region. That's my prayer. And I know that there's a mother here who's been bereaved who I'm sure is able to identify mother to mother and would probably be willing to speak with you. Yeah, suicide doesn't look like anything in particular or any person in particular. Right. And you're so recent in your grief journey that maybe you just got to learn to breathe again. Here, Ina.
I'm actually so glad that we opened up and we heard voices of the mom, and it was so open, and it feels good to be open about this and heal together. So thank you so much for being here. Can we just take a quiet moment and just close our eyes and take a deep breath? Again, thank you so much for being here. And I encourage you afterwards, when we are done, please connect with someone. Please talk to Dr. Morris. She's here. Dr. Kim. There are a lot of people. Make sure that your voice is heard. Make sure that you connected and you got help what you needed. There are sharing kindness resources. If you feel like you would like to share something and it's a burden in your heart, please don't walk away without sharing with someone. Here we have clinician present, and myself and Andrew, Annie is here. We will get resources to you, whatever you need, but please don't walk away here without feeling like, oh, I wish I said something, or I wish I could. Okay? Does it make sense? Yes. Yes, yes. Amanda, where are you? It's for you. I'm privileged to call Amanda my very good friend. And when we talk, it's sometimes like I look at my time, it's like 2 hours passed and we talked. But anyway, thank you so much again for being here. our next event, there's a lot of events. I hope you took notes. We will have a wonderful unifying event because our nation is so divided. On May 7th, we will have National Day of Prayer at Village Green Hyenas Bandstand. It's right on Main Street. There's a townhouse, a brick wall, and there's bandstand, little stage outside. First Thursday of May, which is May 7th, it's 5:30 p.m. It will be a night of prayer, hope, night of unity. You're welcome to come. And again, follow us, follow Sharing Kindness resources, and let's give a hand to our wonderful speakers. Okay.
Ooh, it's chilly out there. All right, I feel like that was like huge. I feel like heavy. Not heavy, but I feel like, wow. So I just wanted to say, like, let's just take a deep breath all together and like think about some hope, though. I need hope. I need hope. I need to hear, what is someone hopeful for right now? Right this minute. What are you hopeful for?
Acceptance of what's happened and to be able to cope when we move forward in life. We're going to move forward in a different way. It's not like you forget the person. You never forget the individual that you love so deeply. But we have to have that hope, these resources to be able to do that and know that other people been through what we have been there. So.
And that is hopeful, because this is how it all starts, a movement. My friend died by suicide when I was 24, and I'm here 25 years later doing this work. This wasn't even in the plan. But it matters. And it came to the plan, and I was hopeful that we could help each other. So I don't want anyone leaving here like super duper sad tonight. I want to say there is hope. We are hope agents, and we're going to go out there and share that hope with Cape Cod and the islands and further abroad to say, it's okay. We're going to help each other. Is that okay? Are you feeling okay? Yes. Yeah, a little bit. Yeah? That's okay. Okay. That's more than 0%, right? So we're going to take little step by step, day by day, day by day. Okay? So go out there and change the world, change the conversation, and be hopeful. Okay?
Thank you. Thank you. Thank you. Please make sure, again, like I said, walk away with a new friend and make sure you talk to someone. Thank you very much.